Welcome everybody to GoLocal Live. I'm Josh Fenton. It is 12 noon. A couple quick updates. National unemployment numbers came out at a shocking high for 6.5 million new filings across the country. Rhode Island ranks third in the country for filings as a percentage of population, behind Hawaii and Pennsylvania. Maybe the most surprising number was Massachusetts also made the top 10. One would have thought a more diversified economy might have held off some of those layoffs, but not so. Rhode Island numbers came out later in the morning at 10 a.m. Those numbers now push us well over 110,000 in total unemployment, a disturbing number off a workforce that pre-crisis was at about 550,000. So doing the math, we're at about 20% unemployment here in Rhode Island as of right now between unemployment and TDI filings. Later this afternoon, we will have a very, very interesting guest at 4 o'clock. Really the man behind, Mr. Muhammad, the man behind the Netflix series on Who Killed Malcolm X, a kind of groundbreaking documentary series that has led to investigator Cyrus Vance in Manhattan to reopen and relook at who was prosecuted for the murder 55 years ago of Malcolm X. Now let's go to Michael Fine. Doctor, thanks for joining us again today. Let's go to the news. The national stockpile appears to be exhausted already, and we really haven't had any location in the country at a pure surge other than maybe New York City.
That's challenging, and that's going to be challenging. That's why states are scrambling to get PPE and ventilators. One would hope that we were turning all our national energy into producing both of those things and getting that production ramped up as soon as humanly possible.
Let's forget the CDC's misstep, which, interesting enough, this Vice President Pence tagged the CDC for their miscalculations on some aspects of this, but let's put that aside. Just in the last month plus, it has been clear to almost anyone in the United States who's been following this issue that a significant healthcare danger was coming. Why have we been so slow in ramping up all engines from your perspective?
Well, I think at the bottom line, it's political in the way we think about healthcare in the United States. We think about healthcare as a market, not as a system. So, we step back and let market actors do what they're going to do, and government tries to get out of their way. Instead of, in a coherent approach would be to have a system that calculates the needs of every single American and projects the needs for surge and for a pandemic, and make sure that we are prepared for it. But we weren't prepared for this, and we're not prepared for the next one. And our lack of preparation is not just material, it's command and control. It's how we run things so that we not only, sort of have stuff, but make sure that we have the workforce that we need and have the workforce where we need it. We do no workforce planning for healthcare in the United States either.
We certainly haven't before. Do you think, and I don't want to bog down on this, but do you think the pandemic implications, the implications of this pandemic will transform our thinking, or do you think we'll revert back to sort of how we did business before when we clean up this mess?
Remember, healthcare is a $3.65 trillion part of the economy, and half of that is likely unnecessary, wasted. Translated is probably profit for people who have something to sell. That's $3.65 trillion worth of energy or that's $1.5 trillion of people who want to make sure they keep their hands on that money.
Yeah.
And they will, I suspect, do everything they can to keep things the way they are. The question is whether we, the people, stand up and say this needs to change.
Dr. Fine, let's go to the numbers. We see a range of different indicators coming from around the country and as well as around the globe. The Wall Street Journal has a very significant investigative piece that says the Italian mortality rate is substantially higher than what's been reported, and they literally almost hand count through towns in Italy, talking to physicians and others, count the numbers who have passed and who have not been included in the Italian reporting system. What's your thought on that? We talked a lot about China yesterday. Are these Italian numbers worrisome if they're being undercounted?
Well, they're worrisome even if they're being correctly counted, but we have no purchase on whether the numbers of other countries are accurate at all. We have enough trouble at the end of the day with our own numbers. I have pretty good confidence in the numbers in Rhode Island in general. But remember, anybody who's practiced medicine knows that death certificate information is highly variable on a good day, which is why we need the Office of State Medical Examiner to validate diagnoses at time of death wherever we can. So I think our numbers are likely pretty good, but in other places in the United States where coroners are often elected and don't have any medical training at all, who knows what the death numbers are like. And remember, I've been arguing that there are two indicators that I'm looking at most closely that I think are the most important and most reliable. And those are the numbers of people in the ICU and the number of deaths. Those are the final common denominator numbers that make a difference, and those are the numbers I look most closely at.
After lobbying the Department of Health a number of times, they have now included, GoLocal has lobbied for them to include the ICU numbers. The good news was that the ICU number reported yesterday was tied to the coronavirus, was an amazingly low, I think it was 14. That's the best news we probably heard in the last week or 10 days.
Yeah, and I think the data that the department is now putting up on their website is very good. We're getting breakdown town by town. We're getting some of that detail, and it's very helpful. I'm really watching closely not only the total numbers, but the rate of rise, particularly of deaths and ICU numbers. The deaths, are heartbreaking, and the number is probably too small at the moment to make meaningful statistical judgments from, but it's a number that I keep very close focus on.
Give us the updates on the numbers here in the state and U.S. and global.
Let's start with recovery global. That's where I always love to start, remembering this is a mild disease for most of us, and an asymptomatic disease for many of us. So over 200,000 people have now had and recovered from coronavirus around the world. We have about 966,000 cases around the world. We will likely top 1 million today if we haven't already. Increasing though, continually increasing day over day. The U.S. numbers are now 217,000, up about 27,000, also increasing day over day. In Rhode Island, yesterday we're at 566 with 77 new cases, 60 people in the hospital, 14 people in the ICU, and 10 deaths. Let's hope it stays there, though you and I know it won't.
We talked yesterday about China's numbers. We talked a little bit today about Italian numbers. One of the problems, though, of those faulty numbers, if they are incorrect by significant proportions, is much of the modeling that the United States best thinkers are working off of, at least from a conceptual standpoint of setting up the formulas, are based on those numbers coming out of other countries in part, correct?
Absolutely. I mean, it was the Wuhan numbers and the China numbers in general that I studied originally to get a feel for how this thing worked as a whole.
We're seeing some terrible situations in Massachusetts. Yesterday, the governor functionally appointed a special prosecutor, I don't know how to call it any other way, and a significant attorney to go in and investigate what has taken place at the Holyoke Soldiers Home, which has had, as of yesterday afternoon, 13 deaths and significant concerns about how that was being managed. There's lots of information coming out about some of the nursing homes in Rhode Island. Have we done enough? Have we been vigilant enough in protecting those who are in nursing homes here in Rhode Island?
Well, I think we've done the best we can so far. But what I'm looking for is some change in testing process. I would love us to change what we do and start testing healthcare workers weekly. So we have a sense of who's got it asymptomatically, because they're the people who, without intention, will unintentionally bring it into the nursing homes where people are most vulnerable. I'd also love to see us test before the end of any isolation or quarantine. You know, we put people in quarantine or isolation for 14 days, they don't get symptomatic and we think they're done. But we know now that 25 to 50% of people who have had the disease have it asymptomatically. So we're missing the opportunity to find some disease. Once we've identified people who are at risk and need to be quarantined, I'd love to see us do it differently that way. And that will help us protect the community and protect health workers altogether. I think, you know, I need to get some confirmation, but I think the numbers of positives who are healthcare workers are actually quite substantial. I heard one number on a conference call yesterday. I want to get confirmation today, but it was a real substantial number that we need to pay attention to.
Yeah, the numbers in New York City, 17% of the New York Police Department yesterday called in sick. I believe the number between staff and direct police officers is 7,600 have tested positive. Those frontline workers are the ones who are out there meeting people, intervening in situations, and the first responders, we're putting them at tremendous, tremendous risk.
And you don't want nursing homes and hospitals to be the place where the disease spreads.
Yeah.
And spread unintentionally by healthcare workers, because that's the population who's most vulnerable.
Doctor, the numbers in Rhode Island with 566 cases are starting to show a little bit of patterns, although the patterns oftentimes, I think the Department of Health has done, and by the way, that was after much prodding from news organizations to report those numbers by communities, are starting to show some patterns. But when you adjust for population, maybe not quite as much as one would think. Providence was a significant portion, but Providence is also 20% of the, almost 20% of the state's population. Other places like Pawtucket, and I think it's North Providence, are actually showing significantly higher percentage of population that have tested positive. What do you see developing over the next few weeks?
Well, I can't predict what's going to develop. I've run the numbers this morning on Cranston, Woonsocket, Providence, and then I put the Blackstone Valley, Pawtucket and Central Falls together. The numbers so far are that Providence and Cranston are right about the state's case frequency rate, but Pawtucket and Central Falls together are running about twice that. And that's been a concern of mine from the beginning because of the dense population. So we'll have to keep our eye on that and see how that changes with expanded testing, understanding that now the availability of testing and where it's located will have some impact going forward. Previously, with all testing happening mostly for people who were seriously ill and were in the hospital, we didn't have any impact or much less impact of where test sites were located. But we're going to see that impact now, I'm afraid.
Well, certainly the density of population in Central Falls, I think at one time in American history, Central Falls was the most densely populated community in the United States. But Ronaldo Almonte has been literally yelling for weeks that there's not enough education outbound at the Latino community, especially in those areas in which Spanish is a first language. The governor's office response is, oh, we've translated things. And his response is, well, that's great that you've translated stuff, but that doesn't really help them if they don't know there's an issue coming in a significant way, or that where it would be posted, etc. So are we now doing a better job in getting information out to the Latino community in those areas in which specifically Spanish is a first language and it's a more densely populated first generation community?
Well, I don't know who the we is, but certainly Ronaldo has been fantastic, and Latino Public Radio has been fantastic. I think they did a special segment over the weekend with a couple of Spanish-speaking health professionals, which was great. Progreso Latino is involved at the mayor's offices in Pawtucket and Central Falls are working hard on this. So I think we're doing a little better, but the devil will be in the details. As I've said before, this virus is a fierce taskmaster, and what you did shows up pretty quickly in the rates of disease. So it's not about what your intention was. You learn how effective you were by seeing what happens as disease is transmitted or not.
Dr. Fine, anything else we should know today?
I think that's it. I think you're going to see a change in recommendations around masking. I'm not sure. I think we'll see masks be used more commonly. I think we're doing pretty well in Rhode Island so far. We got our fingers crossed. And what people do every day, in their personal choices and even in their houses, is going to make the biggest difference right now. We still have the future to figure out, but for right now, it's what we choose today is what matters.
Dr. Michael Fine, former director of the Rhode Island Department of Health, thanks as always for joining us again today, 4 o'clock. Please tune in, the man behind the Netflix series, Who Killed Malcolm X. I think an exciting and a nice diversion, a different discussion than coronavirus this afternoon. Thanks everybody for tuning in.
Thanks, Josh.